Welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Hey everybody, welcome back. We're here today with episode 2307 of the Cabral Concept. This is our Total Wellness Tuesday, and I wanted to be able to go over a topic today that we haven't chatted about for the past, at least couple of months, maybe even a year or so, and that is how our oral hygiene, how our oral health actually affects our overall wellness and longevity. So a lot of times when we think about, achieving our wellness goals, our body transformation goals, or our longevity-based goals, we overlook the importance of our actual teeth and gums. Why this is so important, and I've actually chatted about this in the past, so I do want you to check out episode 2307, the show notes. So if you go to stephencabral.com/2307, in the show notes today, I'll actually share with you previous podcasts I've done on how to find a good biological dentist, on oral hygiene routines, meaning like, should you be oil pulling? If so, what type of oil? Should you be flossing? If so, what type of floss? And toothbrushes, all of those different things. So I podcast on those, and I do want to make sure that I link those up for you. However, today though, I want to really try to impress upon you the fact that gum disease, bacterial buildup in the mouth, and some type of breakdown of the teeth, which we'll talk about, can actually affect your overall chances of getting type 2 diabetes and cardiovascular base risk. None of those things ideal, but overall it can cause inflammation in the body. And we know that inflammation in the body is implicated with over 90%, and I would say probably 100, of all dis-ease in the body in general. So how can this be? How is that happening? And what can we do about it besides just brush our teeth, floss our teeth? All right, so let's go over that today. First, I just want to give you a rundown because unless you're someone that's actually studied this, you probably don't actually even know how the teeth are built, how they're affected at all. So we're just going to give you a super quick rundown. But the teeth that you see, right? So the actual white of the tooth that you see is called the enamel. So the enamel, of course, can break down. We'll talk about that in a moment. But below the enamel, you have something called dentin. Okay, so that's the layer below the enamel. They're about the same thickness, but the enamel is the outer coating. That's the protective layer. Below the dentin is the pulp. So that's where the nerves are going to go up to inside of the pulp. Think of the pulp as like the soft tissue that feeds all the nutrients and blood flow to the teeth, but also it can take the bacteria and it can take also nutrients back in through the tooth as well. So it's a two-way street where the roots run up, right? So if you talk about a root canal, well, what do you need to do? You actually need to get to the pulp of the tooth to be able to remove those roots. And then we have the overall bone in which the teeth sit into underneath the gum base line. So when you talk about the crown of the tooth, you're really talking about the dentin, you're talking about the enamel on top of it, and you're talking about the roots that reach up to above the gum line, all right? So everything above the gum line, again, I'm using this in air quotes, essentially the crown of the tooth. Now, everything below the gum line is really looking at the overall root, although, of course, the teeth, right? The teeth extend down below the gum as well and sit into the bone. So when we start to get tooth decay, which we're going to talk about, how does that happen, how to prevent it, what you're talking about is some plaque buildup on the tooth itself, around the gum line, and also there can be inflammation of the gums leading towards gingivitis, but you can actually get plaque on top of the teeth. Now, after a while, it starts to decay the actual enamel. And when it starts to break down the enamel, we can start to lead towards a decay in the dentin and actually getting cavities. So these are cavitations in the teeth. These are all basically holes in the teeth that then eventually will expose through the dentin to the pulp, which leads to the roots. You're definitely going to have most likely pain by that point in the teeth or in that tooth itself. And that is, of course, when the tooth may or may not be salvageable, and you may have to have some type of dental-based surgery, whether it be a root canal, it might be a removal of the tooth, it might be a crown. There's different types of things that we can go into. I've actually laid out all the different scenarios, and essentially, after speaking with many experts in this field, I am not an expert biological dentist. However, I do know many biological dentists, and I've shared that in my book, The Rain Barrel Effect. And of course, I have podcasts on that as well. Like I said, I will be sharing that with you as well. One of the things why I think that this is so important is that the rate right now is about 40%, probably higher, of adults over the age of 30 that have some level of gum disease or the early stages of gum disease, often called gingivitis, that begins with inflammation and a deterioration of the gums away from the teeth. We start to get those receding gums. We start to get maybe bacterial buildup, tartar buildup, and some type of gum-based disease. Not ideal, but often caused by medications that people are on that might be causing dry mouth. They might have had fillings in the past. They might not be taking care of their teeth to the best use possible. They might be under a lot of stress, which then again decreases saliva output. That can dry out the enamel and actually crack it. Not good at all. We'll talk about that. Then there's also people that smoke, right? If you smoke, you're most likely going to be breaking down the actual teeth. Not good. And another part of that is processed foods, right? So processed foods, sugars can allow the anaerobic bacteria in the mouth to begin to multiply, which can create all sorts of not ideal bacteria that can also lead to then cavitations, cavities, and gum-based disease. So as I stated in the beginning of the show, this can all lead to then heart disease. Like that's the biggest risk. There's definitely an increased risk for type 2 diabetes. There's no doubt about it. It's not going to raise your blood sugar, but certainly going to raise your inflammation-based levels. So that's certainly a concern as well. And what I would say too is that there is a study, and I was just reading this, that good cleaning, so tooth cleanings, your own personal hygiene as well, can actually lower hemoglobin A1C, which is pretty remarkable. So that means like by taking better care of your teeth and your mouth and your gums, you can actually lower your base level glucose level. So hemoglobin A1C is essentially a 90-day average of your blood sugar. It's represented by, let's say, a 5 to a 5.7, 5.7 and above. You're moving towards type 2 diabetes or have type 2 diabetes. And essentially, most people in our practice are at that 5.5 to maybe 5. Some people in the high 4s that might drop a little bit more into hypoglycemia at times. But that's an indicator of your overall glucose levels over the past 90 days. So that is one point. But again, the bigger factor is heart disease. So if we know that the number one killer in the entire world is heart disease, we need to approach this from every level possible. Because unfortunately, again, it is the number one cause of mortality. It certainly kills people before their true life expectancy of what it should be, and oftentimes strikes in the 50s, believe it or not, all the way through, again, your mid-70s, depending on your, there's a lot that goes into this, meaning like gum disease is not the only part of it, but what are your overall HSCRP levels? What are your overall homocysteine levels? What's oxidized cholesterol look like? All of these things matter. I know a lot of people don't like to look at cholesterol. It still matters. It's not the only thing, but it's one factor, right? Reductionist methodologies allow you to say only this one thing matters. No, that's not the case at all. We look at oxidation, stress, inflammation in general. Well, when you have bacteria and you have inflammation moving through the body, especially from the mouth, it can cause inflammation of the arteries. It can cause plaque buildup in the arteries. So not a good thing. And a big study demonstrated that individuals with gum disease are 25% more likely to develop heart disease. And so again, in my opinion, it's one more thing to look at, especially since bacteria traveling from the mouth into the bloodstream can actually harm the valves of the heart. And I'll link up these studies for you if you want to go a little bit deeper as well. So now then it comes down to, well, what do we do, right? Because I don't want to provide you with the gloom and doom without saying, listen, we can all move past this. We can all make sure that we're not suffering from this. First things first, find a good biological dentist. I will link up a website that allows you to find a good biological dentist. And that's very straightforward, very easy to do. These dentists have postdoctoral training in mercury amalgam removal. If you need to have that done, you definitely want to do that with a biological dentist with the latest state-of-the-art tools to be able to make sure that you are not bringing all that mercury back in your body. But also, they're going to use typically much less invasive surgeries and protocols if that is actually what's called for. They might be using ozone injections. They're going to be doing far less x-rays of your mouth, minimally invasive x-rays if they need to. They're not going to be doing x-rays every time you go in, which I certainly do not recommend. So that is that. So you definitely want to meet with your biological dentist, have them take a look. The very first time you go in, you might be doing x-rays, but again, I do not recommend that all the time, especially if you have healthy teeth, for sure. But let me give you some ones that you can do from a lifestyle perspective alone. Just basically 3 main things that you can be doing, all right? So the biggest thing is this. You want to make sure that you're limiting, if not completely eliminating, your processed beverages and foods, okay? So the best of your ability, you want to cut down on all the things that are processed, flour, sugar-based. So as many of the muffins and croissants and baked goods as possible. Without a doubt, we want to lower or completely eliminate those. Now, can you have them once a week? I have no problem with that, like whatsoever. If you're a healthy individual and you want to have one of your favorite foods once a week, again, I don't think that anybody needs to deprive themselves of that to be a really healthy individual and live a long life. I don't. Now, if you're doing that every day, it's a problem. I mean, it really is. And the same thing, and again, it's not just that. We're talking about all processed foods, certainly candies and anything sugar-based like that you don't want to do. Food is not included in that category. It's just not at all. Fruit works with the bacteria in your mouth. Can it be overdone? It can be with fruit juices. There's no doubt about that. But there's some really good research and studies that show too, like biting into an apple, something with skin is actually good for the gums. So again, be careful with man-made processed foods that come in a box or a bag. That's a good sign that it's been processed. Probably even more so than food, though, are sugary beverages. It's really one of the worst things, if not the worst thing that you can do for your mouth. Drinking any type of soft drink, cola, whatever you want to call it. But even these energy drinks or vitamin waters with sugar, they're all terrible for your teeth. Like they're easily the worst thing that you can do. I mean, they really are. So we want to try to eliminate those as much as possible. What happens if you can't eliminate them? All right, my next tip is this. Make sure that you can do something in order to clean your teeth after eating those things. So either brush your teeth with a natural toothpaste. All of my natural tooth care-based products or oral hygiene products are at stevencabral.com/resources. I don't own any of these companies. I just love to promote people doing great things. Because again, there are people typically behind these companies, these small companies. So stevencabral.com/resources are the things that myself and my family use. And that's natural toothbrushes. It is natural floss, natural mouthwashes, no harsh alcohols or anything like that that will dry out the mouth that are not good for your teeth. So I don't recommend your typical Listerine, Scope, etc. One, they often have all sorts of different artificial flavors and colors in them to give them that bright color. And the other thing is they have oftentimes alcohol in them, which sure, might freshen your breath momentarily, but it dries out your mouth and your teeth, which can then lead to what? Well, it can lead to then oral hygiene-based issues. So we don't want to do that. So if you can't brush, you can't floss after you eat these things, well, could you do a little bit of oil pulling? They make little individual travel ones. Could you do a little individual, even a little bit of coconut oil or sesame oil? That would work. Or you can get a little oil pulling wash. That would be fine. And the last one, if you're not able to have anything, I'm not an advocate of chewing gum. However, there are some healthier versions of gum that you can actually chew after a meal or some processed food or drinks that contain xylitol and other items that would be able to clean those teeth. I don't recommend swallowing a lot of sugar alcohols, but certainly you could chew up a piece of gum if you had to as your last resort. If you're ever chewing gum, just make sure you don't do it between meals, that you are doing it after a meal, because it's going to most likely tell and signal your stomach to produce hydrochloride or hydrochloric acid to digest whatever it is that is in your stomach. So again, the act of chewing tells your brain we are consuming food. So that's why I only recommend doing after a meal. All right, one more tip for you here today. And the last one is minimizing snacking or those sugary beverages between meals. And the reason is that after you eat a meal, believe it or not, your body has to go through all of these different processes after you eat. It causes oxidation in the body in general. There's a lot of energy that needs to be used, and your blood sugar as well as your oral bacteria. There's anaerobic, which is more of the negative bacteria in your mouth, and there's aerobic bacteria. All of that needs to come back into balance. So if there's, let's just call it an assault, if there's an assault on your oral hygiene every 2 hours versus every 5 hours or 4 to 5 hours, then that's not as ideal. So if you can keep your meals, I'm just giving this as an example. You don't have to do this, but if it's 8 a.m., 12:30 p.m., and 5:30 p.m., well, you have plenty of time in between meals for the blood sugar to recalibrate, for your oral hygiene to resettle, and that can be really, really helpful. And again, between meals, you're drinking water, or maybe you're having some herbal tea, and that would be totally fine as well. What's an example of an herbal tea? A ginger tea, a chamomile tea, a tulsi tea, any of those, hibiscus tea, any of those would be completely fine. So I wanted to just share these tips with you today. I really believe that everyone can follow these. And the nice thing is, if you are following them along with my suggestions for the flossing, the toothbrushing, etc., then you are going to save yourself one more risk factor for developing the number one cause of mortality and the number three cause, which is type 2 diabetes. So hopefully this show was helpful. I'm going to link up the previous shows on biological dentists, what that is, who those people are, as well as. And why that's so important, by the way, is because I talked about this on a show before. You should have a team of people, natural health practitioners that are able to help you, that are on call for when you need them. That's their job. That's what they do. So I also have a show on building your own health-based team. I'll link that up. Everything will be at stevencabral.com/2307. Thanks, everyone. Take care. Hope you enjoyed the show. Feel free to share it with anyone else you believe it could serve. I want to sincerely thank you for your support of this podcast. I couldn't do it without you, and I mean that. I truly do. I also want to make sure you knew that we now have multiple ways for you to find your answers to the most difficult health, wellness, weight loss, and anti-aging questions. You can find podcast-specific topics like thyroid, adrenal, hormones, sleep, digestion, Ayurveda, and many more at stevencabral.com/podcasts. That will then link you to your favorite Apple, Spotify, and other podcast players. Plus, all new podcasts and weekly exclusive video content is being added to our YouTube channel at youtube.com/Steven Cabral. And that's Steven with a PH. Head on over and subscribe so that you don't miss any of the exclusive content. Lastly, if you've ever found any of my podcasts or books to be helpful, I would really appreciate it if you could leave a review on iTunes or your favorite media player for the podcast. Rating and subscribing to the YouTube and podcast allow me to reach more and more people and help spread my mission of healing throughout the world. Thank you again for being a part of this movement.